So I'm going to introduce now Chelsea, who is the final learner for this morning. And she's going to talk about hyperhidrosis. And Chelsea, if you are ready, I'm going to turn it over to you.
Perfect. Can everyone hear me okay?
I can hear you.
Yes.
You're good. You're good where we are, and we can see your screen where we are.
Perfect. All right. Good morning, everyone. I'm Chelsea. I'm a fourth year pharmacy student with Dr. Baldwin this month. And today I'm going to talk about hyperhidrosis and what exactly that means. Maybe. There we go. Okay. So some objectives. So after this presentation, you should be able to describe what exactly hyperhidrosis means, discuss the impacts that hyperhidrosis can have on your quality of life and diseases or medications that could worsen the symptoms, and explain over-the-counter and prescription treatment options that are available. So as far as how our presentation will flow today, I'll just kind of give a brief introduction and then go into an overview of the disease and then talk about treatments, and then we'll conclude with a brief overview. So first, what is hyperhidrosis? What does it mean? I know it's a really big word, but essentially that just refers to excessive sweating. So for humans, it's really important that we do have sweating. However, in some people, there is this excess sweating or hyperhidrosis, and it's sweating beyond what is normally happens for people or what our body really needs. So this excess sweat and just amount of sweat and rate of sweating is not caused by like temperature change or something like that or working out, but it's more caused by either a disease, another disease state, or medications that could increase the amount of sweating that you have. So it's actually really common. 1 to 3% of Americans are affected by hyperhidrosis or excessive sweating. And both men and women are equally affected, but it seems from data that women are more likely to report their excess sweating to their doctors. So as far as diagnosis, so a full workup is done, and based off physical exam and a thorough history, your doctor can identify whether or not you have hyperhidrosis. And this disease is common, and it can have some serious social, emotional, and professional consequences if you leave it untreated. So let's talk a little bit more about that and what it means for you and what are potential causes and what other diseases and medications play a role. So what does it mean to you? So whenever you have this excessive sweating, it can affect your general lifestyle. So the clothing that you choose to wear. So you may avoid bright colored clothing because you can see these sweat stains. Or you may choose a polyester material over a cotton material, or even avoiding flip-flops or sandals because your feet might be slick and they might slide out. And as far as how it affects your social life, you may be uncomfortable with physical touch. So giving one of your loved ones a hug or anything like that, or even being fearful to be in public because you don't know when you're going to start excessively sweating. So it definitely has those social impacts as well as a mental impact from this. So you might feel just sad or unhappy or embarrassed of what happens whenever you have this excessive sweating, when it's something that is out of your control. And you may be worried about other people's reaction to it, which could then lead to lower self-confidence, or a feeling like you just are out of control of your body and that it's something that you really can't control. And that also can have professional life impacts. So you may not be as able to be active in participating in activities that you enjoy, or some people will even choose jobs that are accommodating to their sweating. So they may choose to be in more of a office type work environment versus actively participating in more strenuous exercise. So there's a few different types. So there's two different types of hyperhidrosis. So there is primary hydrosis, which is really like the result of something happening, whereas secondary is more focused on a disease state that may lead to disease state or medications that could make it worse. So whenever you have this excessive sweating, I think a common place that we think about is our underarms, but then it also can happen to our feet or our hands, or really anywhere on our body. But the feet, hands, and underarms are definitely the most common. So as far as the primary hydrosis, so those are more associated with those environmental or emotional triggers. So that can be things like anxiety or stress, as well as exercise. Smoking can also play a big role on that, or alcohol or eating really spicy foods can also make you sweaty. Whereas the secondary hyperhidrosis, that can occur from a variety of disease states. So things like alcohol use disorder, acute respiratory failure or COPD, or heart failure, hyperthyroidism, as well as diabetes. Another big one is actually mental disorders or something that affects your brain, and your release of different neurotransmitters. So things like Parkinson's disease, or even hormone-related conditions like menopause or pregnancy, as well as anxiety, or opioid withdrawal or narcotic withdrawal. So as on the secondary hyperhidrosis, there's also medications that can worsen this condition. So things like anxiety medications or diabetes medications. So some of the more common ones are a class of medications that we call SSRIs or SNRIs. So those include things like citalopram or Celexa, escitalopram or Lexapro, fluoxetine or Prozac, Zoloft or sertraline, and then duloxetine. And then on your handout, I put much more details of medications, but I did not include, I just included the most common ones on this slide. Some other, another big disease state that plays a factor is actually diabetes. So things like your insulin or glipizide or glimepiride, as well as pioglitazone, those all are medications that could increase the amount of sweating that you have, as well as things like niacin or sildenafil or Viagra can also increase the amount of sweating that you have. So what health concerns can happen if it's untreated? So kind of like what I mentioned earlier, there are those social or emotional and professional consequences, but also when you have that excess moisture that is on your skin or in these areas, you're at a higher risk of having an infection occur. So whether that be a bacterial, fungal, viral, or yeast infection, that can occur in those places, since there's the moisture, and typically those areas are more hot, so those can cause infections. All right, so now that we've kind of discussed what exactly it is and what can cause it, let's talk about what treatment options there are for treating hyperhidrosis. And it's always important to keep in mind that you should talk to your doctor before starting any kind of treatment. But a lot of these options are available over the counter, so I wanted to discuss them. And just keep in mind that treatment is based on where the excessive sweating is noticed at. So whether it's the underarms, hands, or feet, typically. So the first thing that I wanted to talk about is actually over-the-counter aluminum salts. So some examples of those that you can find are this Dr. Sweat, DuraDry, or Hypercare. And with these, you apply them to your dry skin at bedtime, and then you're going to leave it on for 6 to 8 hours before you wash it off the following morning. So this may take 1 to 2 weeks before it starts working. And once it started working, so you'll do it every day starting out. And then once it started working, you can reduce that to only using it once to twice, so 1 to 2 times per week. It's important to keep in mind that this can cause some skin irritation, and it might cause a little bit of stinging. So that's pretty normal with these medications or these over-the-counter items. So then next, it's also important to utilize antiperspirants, and that is during the day, a daytime treatment that you can use. So there's a lot of different antiperspirants that are out there. So it's important to look at the ones that are prescription strength antiperspirants. So 2 options that I wanted to point out are the clinical strength Secrets and the Certain Dry, which is also a prescription strength antiperspirant. And then as far as other treatment options that are a little bit stronger than over-the-counter items. So I'm going to start with talking about this glycopyrronium, which is the Qbrexza. So that medication works to basically, like, you put it on topically and it works to dry out the area. So it's important that whenever this medication's used, it shouldn't be used in patients that have other diseases that we worry about drying out with. So for example, things like glaucoma or ulcerative colitis or myasthenia gravis, just because that can worsen those diseases. So we just avoid them in those patients. And whenever you go to use this medicine, you just make sure you wipe the skin really dry with dry underarm with a single-use wet cloth. And then after that, you are going to wash your hands and with soap and water after you finish applying. So as far as the top option, which is the botulinum toxin, that's also not quite as recommended as the other options, but it's actually, this is the same thing as Botox. So they only do this 1 to 2 times per year in very severe case, or in cases where it wasn't controlled by any of the other items. And this basically helps to reduce the amount of sweat that is produced by those different sweat glands. And it may not work as well for areas like the palms of your hand or feet, and it's usually used in the underarms instead. So as far as a brief overview, so kind of like we talked about earlier, hyperhidrosis is simply excessive sweating, and it is really common. So there are different diseases and medications that can worsen the sweating. So things like anxiety or extra stress, anything like that can worsen the hyperhidrosis. And as far as treatment options, there are antiperspirants that you can use during the day, those aluminum salts, which you can put on overnight to help dry out the area. And then there are also prescription medications such as Qbrexza. So these are my resources, and I just wanted to say thank you for taking the time to listen to our presentations today. Are there any questions that anyone has for me?
I have had one that was asked, and I don't know the answer. The question that was asked, Chelsea, is if it comes with excessive sweating, does hyperhidrosis have the body odor that accompanies sometimes people who sweat and may smell? Is there a worse body odor?
Yeah, that's a good question. So sounds like the question is there more body odor that occurs if you have hyperhidrosis? And I would say that's really patient dependent. I think a lot of times our body odor is dependent on the foods we're eating and things like that. So I think that would definitely be something that would play a role in whether or not it's going to be more odorous versus just a normal person's. Does that answer the question?
It does. I mean, that was kind of what I was thinking. I just didn't know if you, having researched hyperhidrosis, had a better answer.
Mm-hmm.
Are there any other questions for Chelsea? I gotta check chat. All right. I hear none. I see none. So thank you all for tuning in. For those of you who will be watching this via my YouTube channel, which the Resources for Seniors Meds program does indeed now have a YouTube channel, and all of the in-services will be published on there live. So if you like it and you like what you heard from these learners today, there is somewhere when this is published, there will be a YouTube subscribe link. If you like it, hit subscribe and get all of the future YouTube videos that we put out there. Smash the YouTube button so you can follow the meds program out there. Thank you all. Oh wait, everybody's pinging in and saying you did a great job, Chelsea. So thank you all for tuning in. Next month, I will be recording the hoarding one. It will be published later. But again, if you like what you heard and you want to hear more of these in-services and you can't always ping in, there is a Resources for Seniors YouTube channel for me. You can just hit smash subscribe.